farm bills, on and on. We've got work to do, and we need to get it done.
And that's where we'll leave it this morning with Congressman John Garamendi, a Democrat from California. Sir, appreciate you coming on.
Thank you, John.
The Senate is coming back in now. They'll continue work on the nomination of Mel Watt to head the Federal Housing Finance Agency. And this morning, the chamber confirmed Patricia Millett to be a judge on the U.S. Circuit Court of Appeals for the District of Columbia. As I mentioned, the Senate today confirmed Patricia Millett to be a judge on the U.S. Circuit Court of Appeals for the District of Columbia. It's considered the second most important court after the Supreme Court. Her nomination fills one of 3 vacant seats on the court and represents the first judicial confirmation in the Senate since the chamber changed its filibuster rules last month. As we wait for a senator to speak, we'll hear about the business community's perspective on the budget negotiations.
How the business community is reacting to the ongoing budget negotiations. We turn now to John Engler, the former Republican governor of Michigan and current president of the Business Roundtable. And Governor Engler, let's start with the budget conference that's expected to release some sort of modest budget deal this week. What are you expecting?
Well, we're expecting the Congress to do its work. Let's get the job done. I think the one thing that the business community just is foursquare behind is the idea that if 50 states can pass budgets and, in the most part, get it done on time, Washington ought to be able to get a budget done even though it's late already. And we ought to be able to have some predictability going forward. That's true and useful for budgets. It's also true for regulatory and tax policy and a whole bunch of other things that Washington dabbles in.
Business Roundtable, an association of chief executive officers of leading U.S. companies with $7.4 trillion in annual revenues and more than 16 million employees. When this budget conference first kicked off, what were they hoping for? What were the expectations a couple months ago?
Well, actually, for several years, the hope has been that we'll get serious as a nation about dealing with long-term fiscal problems, because there's no question that we were coming out of a deep recession, 08, 09, but looking ahead, not 1 year or 2 years, but 10 and 20 and 30 years ahead. We've got structural financial problems that we're going to have to deal with. We've got deficits that are not sustainable given the commitment we've made to entitlement programs. Being from Michigan, you know, I've had a chance to watch what's happened in Detroit over a lot of years, deeply involved for 12 years when I was governor, and now from afar. And we don't want Detroit to be repeated in other states or as a nation. We've seen what happened in Europe and Greece and some of the countries over there. Now, I'm not suggesting we're on that path, but at the same time, we need to face up to our problems. Congress actually passes laws requiring companies to do that. We should do it as a nation.
We're hearing modest deal this week, small scale to modest deal this week. Is the idea of a grand bargain where all these issues that you're talking about can be addressed, is that something that is not possible in the foreseeable future?
Well, I don't know how the foreseeable future, I mean, I think it can be done. There's no better time to do that when you've got a president who's in the second term, can't run, won't run again for anything. You've got a Congress where there's divided control. This is the time for the nation's leadership to come together. It would seemingly be the right time where everybody participates and we make adult decisions about the future. I think the importance of the deal right now, of a small bargain, of a modest compromise, is that we're basically relearning how to work together. One of the things that's happening in this process is that you have sort of a return to some regular order. You actually have the two budget chairs meeting. That's an important part of the process, and it's been a long time since the budget chairs have been able to work out a budget and bring the appropriators in, and this is sort of what's unfolding a little bit. And so this is almost learning to crawl before you can walk again.
And yet a major deadline coming up in just a few months here in February. Another debt ceiling showdown is possibly on the horizon. You mentioned adult decisions. What does the Business Roundtable think the adult decision should be on the issue of the debt ceiling?
On the matter now before the Senate, how much of the time that remains is controlled by the Democrats?
147 minutes.
So that's a little over 2 hours, right?
That's
how much time Republicans? The same?
130 minutes for the Republicans.
Oh, I see. Why don't we yield back 130 minutes of our time? That would leave us
The
how much
time is
time?
yielded back.
That would leave us 14 minutes or something like that?
17 minutes.
Oh, that's far too much time. Yield back another 10 minutes.
The Majority Leader's time is now set to 7 minutes.
8, and 9.
Governor Engler, of the president of the Business Roundtable, is here to take your questions and comments. And on Twitter, Daryl has a question about the Business Roundtable's lobbying efforts. He writes, so if the debt ceiling is a bad idea, why not lobby the Tea Party to stop gumming up the works with threats?
We do lobby the Tea Party. We lobby Democrats and Republicans. You know, that is exactly what we did going all the way back to 2011 when this all surfaced. I mean, we said at the time when they were trying to do a budget deal, look, you're going to have to do a budget deal, and you know, there's going to have to be revenues are going to have to be on the table, and spending reductions in a multiple of revenues. So we had everybody unhappy at that time because you've got one group that said, I don't want to cut a dime, I want to spend a lot more dimes. You've got the other side that says, well, I won't allow a dime to be spent until we pay for all the dimes that we borrowed. You know, so it's a, as I say, it's a messy process. The country's probably pretty divided too. If you go out and talk to people, if you look at some of the survey data, there's a lot of 50-50 kind of responses. You've got people today who say, well, cut everything in the budget but defense, cut only defense and increase everything else, cut everything. I mean, there's all kinds of positions that people spell out, and that's the job of somebody who gets elected. You sort of got to sort this through and make decisions. What you can't do is be paralyzed and say, well, it's too hard, I can't decide.
John Engler was elected the governor of Michigan, the 46th governor of Michigan, 1991 to 2003, correct?
That's right.
He's taking your calls and comments. Chris is up first from Anna Maria, Florida, on our line for Independence. Chris, good morning.
Hello. The more I'm listening, the more distressed I get. This is the first time I've ever actually called in to a show, but it's really, a number of things are aggravating, but let me tell you, right at the top of the list is one more person referring to entitlements as if that were a four-letter word. If you walk into a store and you pay for a product, are you not entitled to take it away with you? And that is how people get entitled to Social Security and to the Medicare that they pay for. It's not a four-letter word, and it was intended to be a trust fund. It should have been kept in a trust fund. Congress has been raiding that trust fund for decades. I don't know that much of the American public actually knows that. If you run the numbers, we wouldn't be this broke with Social Security or Medicare if the trust fund hadn't been spent on everything but.
Chris, LMS on Twitter seems like he would agree with you. The LMS writes, long-term fiscal problems aren't due to programs that people paid for and are entitled to. The problems is the policies and agenda of Congress. Governor Engler.
Well, let's try to sort that out, because I think, you know, entitlements is almost a term of art in here, but it really represents promises for future benefits for American, both retirees who have been required to pay into the Social Security system, and as our caller said, well, that's a trust fund, and that's been rated, and there's no question that monies that have been set aside have been used on a cash basis for other things, but the obligation's still there. If there were a dime in the Social Security Trust Fund, there would still be a pretty significant obligation that is calculable. And what we've done with a population as it gets older, just like a pension system really, you have fewer and fewer people paying in and more people drawing out. And one of the things that they've even struggled with is they use what every economist would say is an imprecise measure of a cost of living adjustment to Social Security. The president recommended fixing that. That's had resistance, actually, from members of his own party and from some of the Republican Party. But it's a smart thing that should be done simply because it is the accurate math. But if we think about both Social Security and the real cost, actually, it's not Social Security. That fix is pretty easy, pretty straightforward. I mean, one of the things that the caller didn't mention but always needs to be brought onto the table is when Social Security was set up, everyone knows that sort of the demographic analysis at the time, you got benefits for later in life, but the life expectancy of the time of the enactment of Social Security was about the time when the benefits started. So today that's 20 years longer, and yet we didn't change the system to account for that, so that results in more demand for a what is turning out to be an inadequate amount of money set aside. The real cost is over, of course, in the health care system, in the Medicare system, and those costs. And again, nobody foresaw what those costs would be. Nobody foresaw at the time the systems were being set up how long people would live, how much expensive care would be there, and how much in particular of that care would be there in, say, the last 6 months, the last year of life. So you have tremendous costs. We've promised to pay for those costs, but we didn't set aside the money to pay for the promises. This is no different in some respects. I mean, there are different programs and there are different histories to them. But, I mean, the Detroit retirees today are facing a terrible conundrum because they worked, in many cases, all of their working days for the city and then find themselves today in bankruptcy because the funds that were supposed to be there to pay for their retirements aren't. And they have a unfunded liability. And so the question is, if the city doesn't have the money, and in Detroit you can't print money, you actually have to have taxes, and they're at the highest levels, or you've got to have income transferred from the state or the federal government, and that's not very likely or very easy. How do you pay the benefits? And that's exactly what could happen someday, and that's why people say, look, long term, the balance sheet needs to be worked on. And the tweeter that said, well, these are promises, that's in effect what's happened. I mean, there have been promises that we will write checks in the future without putting aside the money to pay for those checks.
John Engler is the former governor of Michigan and current president of the Business Roundtable.
Madam President, 4 years ago, members of both parties came to this Senate floor virtually every day to discuss the problems with America's health care system and offering suggestions for how we could remedy them. I remember distinctly being here on Christmas Eve, 2009, 7 o'clock in the morning, witnessing a party line vote on Obamacare. All of our Democratic friends voted for it. All Republicans voted against it. I guess the most charitable thing I could say is our Democratic friends actually thought it would work, while Republicans were skeptics about this big government takeover of 1/6 of our national economy. Well, 4 years later, the cost of Obamacare has become abundantly clear. I don't think it's an exaggeration to say that Obamacare is the biggest case of consumer fraud ever perpetrated in this country. A law that was supposed to expand coverage to those without it has instead caused millions of people with coverage to lose theirs. A law that was supposed to improve patient access has instead resulted in smaller provider networks where people are restricted in terms of the doctors and the hospitals they can go see, making it much more likely that people will not be able to keep their doctor should they want them. A law that was supposed to bend the cost curve down has instead caused individual and family premiums to skyrocket. And we're hearing story after story that even if the premiums are lower, what happens is due to co-pays and deductibles, people are finding themselves with thousands and thousands of dollars of deductibles that they didn't previously have, meaning it's more money out of their pocket before the insurance actually kicks in. And we were told that this was supposed to make Medicaid, the safety net program for the most disadvantaged economically among us, and Medicare for seniors, we were told it was supposed to make them stronger. Instead, it made them weaker. A law that was supposed to help our economy has instead hurt our economy by discouraging full-time job creation. Because if you have a full-time job, your employer has got to pay for the full Obamacare price tag. So what they've been doing is moving people from full-time work to part-time work. Indeed, a number of labor organization leaders went to the White House a few months ago and they called the implementation of Obamacare a nightmare, saying it had made full-time work part-time work. But it's worse than that. Obamacare has hampered medical innovation by taxing the very people that build medical devices here in America, causing them to move those businesses offshore or simply to cut down their hiring. And it's placed costly new burdens on small businesses, the entities that produce as many as 70% of the new jobs in America. It's not the Fortune 500 that create the vast majority of jobs in America. It's the small mom-and-pop operation, the entrepreneur that create those jobs, and that's where Obamacare hits the hardest. So it's no wonder our economy continues to struggle. It's no wonder that the labor participation rate, the number of people who are actually in the workforce, is at a 35-year low. People have given up looking for work, and that's an American tragedy. As I stand here today, the broken promises of Obamacare are causing enormous distress and financial hardship for people all across my state of Texas and all across America. It's undeniable that millions of Americans have lost their insurance because of Obamacare, despite President Obama's almost daily recitation that if you like what you have, you can keep it. He was making that promise again as late as 2012, and we know it's not true. We know it's not true, and he knew it wasn't true as early as 2010 when we debated some restrictive grandfathering regulations from the Department of Health and Human Services. Senator Enzi, who was ranking member of the Health, Education, Labor, and Pensions Committee, tried to get it fixed. And again, we saw a party line vote. All of our Democratic friends said, no, let's not provide flexibility for the grandfathering provisions. Let's maintain the rigid grandfathering provisions, which have now resulted in more than 5 million people getting notices that the policies they have, even though they like them, they can no longer have. That's why I've said this is one of the biggest cases of consumer fraud ever perpetrated in the United States by virtue of its scope and the audacity with which these promises were made time and time again, which are demonstrably not true. They're false. We know that Obamacare is leading to a dramatic spike in insurance premiums for many people who buy their insurance in the individual market. You'll recall that during and after the 2008 presidential election, President Obama repeatedly told Americans that his health care plan would reduce their health care premiums for a family of 4 by about $2,500. I don't know where he came up with that number, but it turned out to be just another broken promise. According to the Kaiser Family Foundation, annual premiums for employer-based family health insurance increased by nearly $3,000 between 2009 and 2013. In other words, the president was $5,500 wrong. Rather than going down $2,500, they went up $3,000. For that matter, a recent study by the Manhattan Institute estimated that Obamacare will drive up individual premiums by an average of 41%. Now, I don't know many hard-working American families that can afford a 41% increase in their health care costs from a bill, from a law, where they were promised that health care would be more affordable. The single biggest increase, according to this study, will be in the majority leader's home state of Nevada, where individual premiums are projected to rise by an astounding 179%. The increases in New Mexico, Arkansas, and North Carolina are 142%, that would be New Mexico, 138%, that would be Arkansas, and 136% in North Carolina. What do each of these states have in common? Well, they're represented by senators who voted for this bill, perhaps believing that what the president said would be true. But their constituents are having to pay the price. Such premium increases are particularly burdensome for senior citizens and other folks on a fixed income. For example, in Texas, in Copper Canyon, Texas, recently, one of my constituents wrote to me and said that because of Obamacare, her monthly premiums were increasing by $200, which is only $27 less than her monthly Social Security income. In other words, it takes up almost the entire amount of her Social Security check for her to purchase this insurance. That's wrong. In addition to premium hikes, many Americans entering the Obamacare exchanges are facing higher deductibles. I mentioned that a moment ago. In a front-page story just yesterday in the Wall Street Journal, it was reported that many Obamacare deductibles are so high that people with modest incomes may not be able to afford the portion of medical expenses that insurance doesn't cover. What's that all about? In fact, according to one study, the average deductible for the cheapest individual coverage on the federal Obamacare exchange is 42% higher than the average deductible for individual health insurance earlier this year, before most of Obamacare kicked in. 42% higher deductible. And as we know, many of these deductibles we're hearing are in the $4,000 and $5,000 range for individuals, and they're up to $10,000 or more for married couples. I don't know many households in Texas or across America that can absorb $10,000 in a deductible for your health insurance policy. Certainly that doesn't strike me as a success if the purpose is to cover health care costs and to prevent people from suffering economic hardship as a result. That strikes me as an epic failure. In other words, Obamacare is making it significantly harder for many Americans to pay their bills, to buy groceries, and take care of their families. Again, I've said many times before, it didn't have to be this way. It didn't have to be this way. In 2009, polls demonstrated that the overwhelming majority of Americans who had health insurance liked what they had, and they were broadly satisfied with it. That's why the President said, I assume, that if you like what you have, you can keep it, because about 90% of the respondents said, we like what we have. So if you're the President trying to sell this Affordable Care Act, so-called, you wouldn't want to scare those 90% of people into thinking you can't keep what you have, even though you like it. And so you misrepresent what you're selling. You tell people, no, you can keep what you have. And you know what? Your premiums are going to go down, and it's all going to be all right. If we had focused on those people who either did not have coverage or who had inadequate coverage, obviously a smaller subset of Americans than that whole country, if we focused on them and dealt with their challenges in purchasing health insurance, we could have done much better. There were millions more who had low-quality Medicaid coverage that many doctors refused to accept, because in my state, Medicaid pays a doctor about 50 cents on the dollar compared to private insurance, and many doctors said, look, I want to see more Medicaid patients, but I simply can't afford to do it. I've got to opt for higher-paying private insurance patients. And we know that Medicare was facing a fast-approaching bankruptcy date. What Congress could have done, what we should have done, is to enact sensible, narrowly drawn, targeted reforms, number one, aimed at improving the coverage options for each of these groups and strengthening and preserving Medicare and Medicaid. We needed to bring down the costs, not jack the costs up. I mean, if you ask most people what the biggest problem they have with their health insurance, they say it costs too much. And we've made it worse. It's worse, not better. To bring down the cost, we could have allowed people to buy health insurance across state lines. I know that doesn't sound like a panacea, but most states have captive insurance markets, and many state legislatures, including the Texas legislature, have mandated coverage that many people simply don't want, but it adds to the cost of their health coverage. So I could have the choice to buy insurance across state lines if we enacted this reform, instead of I like the insurance coverage of Wisconsin or in Louisiana or somewhere else. If that suited my needs, I could buy it there. And we'd have a true competitive market. And people would compete based on quality and price. But we don't have that now. What else could we have done? Well, we could have expanded the use of tax-free health savings accounts paired with high deductible plans, like the kind I talked to a number of my constituents in Austin, Texas about it, who are employed at Whole Foods. They cover roughly 80% of the out-of-pocket costs for health insurance through health savings accounts and high deductible insurance. And the employees, I think it's still the case, it was then, still vote on an annual basis what kind of coverage they want. And they vote for this type of coverage because they're satisfied with it, and it gives them a sense of ownership, which is actually true, that the money put in a health savings account they get to keep, and if they don't use it on their health care, then they get to save it like an IRA or something like that. But it also changes the calculation. It makes people much smarter shoppers. And it comes farther, moves us farther along to a system where people can shop for their health insurance and their health services like they do everything else. And it'll bring down costs, and it'll improve quality of service as a result of competition for that business. And we could have cracked down on frivolous medical malpractice lawsuits, which cause defensive medicine. Just think about it. If you're a doctor and you're worried about losing everything you've worked a lifetime to achieve in terms of your assets in your medical practice, the last thing you want to do is be subjected to a lottery-type lawsuit. And so the easiest thing for those doctors to do, I know they don't do it on purpose, but is to make a decision to provide a test or a treatment not so much based on your clinical opinion, but based on your desire to not be sued and not to be second-guessed 2 years later when somebody comes in and says, well, you should have done this, you should have done that. So the temptation is to do everything and to run up the cost of health coverage. Well, these are just a few examples, but by lowering costs across the board, these reforms, like I talked about, which the President and his political party rejected, we could have helped people who already had coverage. And we could have helped those who previously could not have afforded coverage. Now, some people have said, I've heard it, if I've heard it one time, I've heard it 1,000 times, they said, well, we need Obamacare because people with pre-existing conditions couldn't get coverage. Well, that's a serious concern. But we already have in place high-risk pools in the states, and if we needed to help those states provide coverage to people with those high-risk health conditions, we could have done it a whole lot cheaper and a whole lot more efficiently than creating this huge monstrosity, this huge bureaucracy, this huge expense known as Obamacare. So we could have increased funding to the high-risk pools that were already operating in about 3 dozen U.S. states. You know, the irony is, Madam President, that the people in the high-risk pool in Texas, they got a letter said your coverage has been canceled effective December 31st. The very people Obamacare was supposed to help. Your coverage is canceled because Obamacare kicks in January the 1st. But because people were worried about their ability to get on the exchanges due to the website problems, the Texas legislature decided, and the Texas Department of Insurance decided to extend the coverage of the high-risk health insurance pools in Texas so that people wouldn't fall through the cracks because of this train wreck of a rollout of Obamacare. And how about Medicaid? We hear a lot of discussion about Medicaid. Well, I've already mentioned that Medicaid only reimburses doctors about half what a private insurance policy would, so a lot of doctors simply can't afford to see a new Medicaid patient. In Texas, only 1 doctor out of 3 will see a new Medicaid patient for that reason. It's not because they don't want to, it's simply because they can't afford to do so. We could have made it a lot easier for states to bolster their Medicaid program and deliver targeted policies that would allow them to manage Medicaid populations. For example, create a medical home, for example. But because of the red tape that Washington refused to cut, Medicaid ends up, in many instances, being an appearance of coverage, but you can't find a doctor that'll see you. What good is that? That's, to me, a sleight of hand, and part of the reason why I call this one of the biggest cases of consumer fraud in American history. And to help Medicare patients, those are, of course, our seniors, we could have increased private competition and patient choice by embracing the premium support model that was endorsed by 10 members of President Clinton's Medicare Commission back in 1999. That's not a partisan solution. It's one that President Clinton's Medicare Commission embraced back in 1999. The reforms I've just outlined would have given us a genuine national marketplace for individual health insurance. Unfortunately, our friends across the aisle and our president decided to take a different path with the Affordable Care Act, or Obamacare. Unfortunately, the folks who designed Obamacare consciously chose to destroy the individual market and force millions of people to pay for Washington-mandated coverage they didn't need and they didn't want, and at a price they can't afford. Rather than adopt measures to bring down the costs and coverage issues for a subset of the population, the roughly 10% who weren't among those 90% who said they liked what they had, the President and his allies chose to wreck the existing health care system, to wreck it, to make it worse, not better. As a result, they've made the cost problem worse. They've jeopardized physician access for millions of Americans who like their current health plans and wish to keep it. And of course, now the administration is boasting that the website is mostly fixed. And indeed, by most objective reports, people aren't experiencing the same sort of epic failure they did when they first tried to get into the Obama exchanges. But at this point, the President and his allies have lost all credibility with regard to other aspects of Obamacare, which I've mentioned. And fixing the website won't fix the underlying deficiencies of Obamacare. These aren't glitches. These were baked into the cake. These were designed. This is the way Obamacare was created and was supposed to work, notwithstanding the fact that the American people had been sold a bill of goods to the contrary. Indeed, the only way to solve America's biggest health care challenges is a do-over, to replace Obamacare with the sort of patient-centered reforms that I mentioned a few moments ago. Obamacare may be a complete disaster, but it's not too late for us to work together to fix what's broken and to start over. Madam President, I yield the floor. Madam President.
The senator from Wyoming.
Thank you, Madam President. I ask unanimous consent that the quorum call be vitiated.
The Senate is not presently in a quorum call.
Unanimous consent to speak as if in morning business.
Without objection.
Thank you, Madam President. Madam President, with less than 2 weeks remaining from the deadline for people who need to sign up for health insurance that starts for them to be insured for January 1st, there's a significant amount of anger as well as anxiety across the country. The website where people are supposed to go to buy that insurance has been plagued with problems that everyone in the country seems to know about. And that has caused huge amounts of anxiety. I heard about it last week in Wyoming. I hear about it on Capitol Hill with staff members, and I hear it pretty much anywhere I go. What people have been learning is that the problems with the website is just actually the tip of the iceberg. The Obama administration has been saying that it's been fixed, that the problems with this health law are fine, that everything is good, that a majority of people are having good experiences. I remember listening to the president not long ago, sitting with Bill Clinton, saying easier to use than Amazon. Well, that's not what the American people found. He also said cheaper than your cell phone bill. He said you'll be able to keep your doctor if you like it. But the law continues to leave so many Americans struggling with higher costs, with greater confusion, and really with a lot less confidence in the administration. People all around the country are worrying if the administration even knows what it's doing. So when I talk about the website being just the tip of the iceberg, people around the country are running into higher premiums, canceled coverage, finding out that they can't keep their doctor. They're running into fraud and identity theft issues and higher issues in terms of higher copays and out-of-pocket costs and deductibles. People at home in Wyoming, and I went not just around communities in the state and traveled to a number of different communities, but also went to my own medical office, where I practiced as an orthopedic surgeon at Casper Orthopedics for 24 years. And people were telling me how worried they were about the higher costs that they're seeing regarding paying for insurance for next year. I got a letter from one man in Cody, Wyoming. He talked about the rates that he's been quoted are going to go up from about $860 a month that he pays now. He's a family of 4. To $2,400 a month, $860 to $2,400 a month. He said, I'm not sure what planet they think I live on, he said, but there is no way I can spend more than half of my monthly income on insurance. Well, I hear the same thing from people all around Wyoming. People are having the same sticker shock all over the country. Now, we know that more than 4.7 million Americans, 32 different states, are being told that they can't keep the insurance that they have. And when you take a look at the map, Madam President, you know, we don't have the numbers yet on certain numbers of the states, and, including the state of Wisconsin. We don't have Illinois. We don't have Ohio. We don't have Texas. We don't have Virginia. So we really don't know how many people have lost their coverage, but we know at least 4.7 million Americans were told that they can't keep the insurance they had, in spite of what the President may have promised them. Well, now what they have to do is buy new Washington-approved health coverage that really may not be the right coverage for them and may likely cost more than they were paying before. Millions of Americans are going to be forced to use money that in the past used to pay rent or to put their children through school or to invest in their communities or in a business to help make repairs of the house. And now that money is going to go to pay for higher premiums as well as the incredible high deductibles that people are seeing related to the health care law. It's, I mean, it's interesting looking through the papers. This was yesterday's Wall Street Journal, Monday, December 9th, above the fold, right here, front page, deductibles fuel new worries of health law sticker shock. The article says that the average individual deductible for what is called a bronze plan on the exchange, that's of course the lower priced coverage, it's $5,081 a year, according to a new report on insurance offerings in 34 of the 36 states that rely on that federally run online market. Well, this is 42% higher, the Wall Street Journal reports, than the average deductible of over $3,500 for an individual who purchased plan in 2013, which is, of course, before much of the federal law took place. So what people are seeing, and the Wall Street Journal reports there above the fold on the first page, is higher deductibles by a lot. And it's not just the Wall Street Journal, the New York Times. Yesterday, Robert Pear's article on health exchanges, premiums may be low, but other costs can be high. It says as consumers dig into the details, something this body never did. Members of that part of the body who voted for this health care law never did dig into the details. It says as consumers dig into the details, they're finding that the deductibles and other out-of-pocket costs are often much higher than what is typical in employer-sponsored health plans, the plans that many of these people have had in the past. So what we're seeing is not just the higher costs, not just the higher deductibles, the higher copays. There's also a lot of confusion about the health care website itself, and that's, I think, only going to get worse. 10 weeks after the website launched, there's still an awful lot that's broken, including the parts that actually get people the insurance that they think they signed up for. A number of my staff have applied, and they believe they've signed up for health insurance. They're not sure. They haven't yet gotten confirmation, and I know that members on Capitol Hill who have staff signing up are experiencing that same thing. Last month, one of the officials from the Department of Health and Human Services testified in the House of Representatives that as much as 40% of this website system still hasn't even been built yet. The website still has trouble transmitting information to the insurance companies once someone has chosen a plan. The website was down again earlier today. Still hasn't figured out how to automatically pay the portion of premiums covered by government subsidy. There are still many, many security holes that can be exploited by con artists, by hackers. Certain branches of the government have been warning citizens to be cautious when going on the website because of the concerns about exploitation of people who are trying to use these in a fraudulent way. And then you hear the administration who is bragging. I mean, it's really sad that almost 9 weeks after the website opened, the administration is now bragging that it only has an error rate of 10% on one important step of the website. 1 in 10 is their error rate. This is a president who said that the website was going to be running like Amazon.com. He said that 3 or 4 days before the website opened. Now, 9 weeks later, he's delighted that the error rate is still 1 out of 10. Does the president actually believe that Amazon would accept a 10% error rate in their customers not being able to finish their purchase? All of these flaws and failures have led to a dramatic loss, I believe, of confidence by the American people in their government. And according to a new Gallup poll, 52% of Americans are in favor of scaling back the health care law or repealing it entirely. People continue to turn against the law for a number of reasons, and it's not the website, it's the higher premiums, it's canceled coverage, it's can't keep their doctor, fraud and identity theft, higher copays, higher deductibles, and confusion about what's going to go wrong next, because so many things that the president and his administration have said, have looked into the camera, told the American people would be one way, turned out to be something very different. There have just been so many changing stories coming out of the White House. The president said if you like your health insurance, you could keep your health insurance. And then he actually said period, like a punctuation mark, that was it. No ifs, ands, or buts, just the period. And people now know all across the country, those who voted for him, those who didn't, what they all know is what the president said wasn't true. The president said if you like your doctor, you can keep your doctor. Well, on Sunday, one of the architects of Obamacare went on Fox News and admitted also that that wasn't true. This is Dr. Ezekiel Emanuel, brother of Rahm Emanuel, the former chief of staff of the White House, is a medicine professor. And what he said is if you like your doctor and you want to keep your doctor, you can pay more for insurance that includes your doctor. A lot of places you can't even buy insurance that will cover that doctor. This isn't at all what the president promised. And it's interesting, in even the paper, the Financial Times, yesterday, health care insurers cut costs by excluding top hospitals. So you can't even go to the hospitals. There's a picture here of MD Anderson Cancer Center from the University of Texas. Plan will not cover treatment at Houston Cancer Center. Well, so if we have somebody who's lost their insurance, who's been going to that cancer center where their doctors are, and they're losing their insurance on January 1st, not only you can't keep your doctor, you can't keep your hospital. We see children's hospitals around the country, people that are not going to be included in these exchanges. So children with leukemia come January 1st, losing their doctor, losing their hospital. But that's what the President and that's what the Democrats in this body who voted for this health care law have given to the American people. You know, just before Thanksgiving, the Obama administration announced that it would have to delay a health insurance exchange that was supposed to let small businesses shop for insurance. I remember hearing speeches on this floor about small businesses and being able to find affordable insurance. Well, it turns out, once again, the administration knew at least 6 weeks before that they were going to have to delay the program. Did they admit it to the American people? Did they tell the truth? No. They waited. One broken promise after another, one statement after another, the administration knows is not true. So is it a surprise then that the President of the United States is viewed as untruthful by a majority of the people of this country? It's a terrible situation for anyone to put their country in. You know, back when we first started talking about the health care law, Republicans offered ideas for how to give people what they really wanted, which was reform that lowered costs and improved access to care. That's what people were concerned about. So many of the complaints we've heard around the country had to do with the cost of care. So President Obama and Democrats in Congress refused to listen. Ignored all the warning signs, used raw majority power to force this bad law on all the American people. I remember the vote in this body, Christmas Eve morning, voting on a health care law, watched it cram through party line votes, and now Democrats in the Senate decided to make another power play and broke the rules of the Senate just this couple of weeks ago to change the rules of the Senate. They took a drastic and unwarranted step so that they can have the power once again to force more bad ideas like the Obama health care law onto the American people. They say, we don't need the 60 votes now. All we need is a simple majority. Let's change the way that the Senate has run for well over 100 years because, once again, the Democrats say, we know better than the American people. We know better than you. It's what the President said with his health care law. And now the American people are realizing, well, what they knew all along. This isn't what they wanted with health care reform. Regrettably, it's what they're living with now and are seeing: the higher premiums, the canceled coverage, losing their doctor, the fraud and identity theft, higher copays, higher deductibles. And it's interesting, even today in the Washington Post, front page, above the fold, under health law, insurers limiting drug coverage. Costs may soar. And it talks about for many different ailments, including for those with HIV. That's a result of the health care law. If this health care law would not have been passed, forced down the throats of the American people, with the President telling one falsehood after another, deliberately designed to mislead the American people, you would never have seen a headline like this today. If President Obama really wants to help the American people, he's going to sit down with Republicans and talk about the real issues to reduce costs, to get rid of all of this confusion that he and the Democrats have caused, and to restore people's confidence in America as well as in him. There's a better way. Republicans agree we need to reform America's health care system. We think that those reforms could have been done without the kind of harm caused by the President's health care law. Thank you, Mr. President. I yield the floor. And note the absence of a quorum.
Clerk will call the roll. Mr. Alexander.